Hi everybody, this is Dr. Jamie Marich, and today we're going to be working on one of my favorite instant coping skills, which is something called the clench and release exercise. And as the name of the exercise suggests, what we're literally going to do is clench a group of our muscles, and then with the exhale, go ahead and release it. So in the spirit of doing it instead of just talking about it, let's go ahead and jump in and do a simple clench and release exercise to start. So let's go ahead and make fists, if that's physically available to you. So as you clench these fists, I'd like you to just bring up something that causes you a little bit of annoyance, a little bit of disturbance. Doesn't have to be a big major trauma or big major stressor, but just something that normally kind of makes you go like this. So as you clench, feel the muscles contract, feel the nails dig in. And then when it's too uncomfortable for you to keep holding on, with your exhale, slowly, gently release. And just notice that sensation of release. Notice that sensation of letting go. Maybe wiggling those fingers around. Oh, shaking them out. And just allow your body to experience release. This is one of those exercises where we could beat ourselves up over not being able to let go or release, but this exercise, literally by its very name, teaches our body how to release, how to let go. By its very action, promotes letting go. So if you struggle with letting go, especially in a real momentary situation where something is just coming over you, doing a real instant clench and release like this, just maybe 2 or 3 sets very slowly, is often a nice way to kind of reset where you're at. The nice thing about this exercise is that literally any muscle group can be clenched and released. So here's another one of my favorite variations about it, because I often struggle with what I call spiking my shoulders. My shoulders always being on high alert, and I think that's because that symptom of heightened arousal, hypervigilance, has always been something that I have sought to address over the years. So this is like the very posture of hypervigilance that a lot of trauma survivors struggle with. So go ahead and try this. Spike those shoulders, just like we were clenching our fists. So spike. Some people could hold on to this for a long time. Some people it gets really annoying really quickly. And my invitation is whenever it gets too annoying, too uncomfortable for you to keep tensing, know that at any time you can slowly and gently release it. Release it with your breath. And then if you want to really continue that release, feeling it going down your arms, doing a nice organic stretch with it. It's always a nice little variation to put on the end of it. So again, I invite you, just notice how it feels in your body to be able to release. Notice what it feels like to be able to release. In another video in this series, we're going to be doing this same exercise with more of a bilateral variation, and then in yet another video, I'm going to be walking you through a full progressive muscle relaxation. This clench and release exercise is really a modified, very express version of the progressive muscle relaxation technique, which promotes exaggerating the tension so that with the release, we can really experience the letting go. And if practiced consistently over time, any of these progressive muscle relaxation exercises are really wonderful ways of teaching your body how to let go, especially if you identify as somebody who always holds on to things, or if you identify as someone who just generally experiences body tension. This is Dr. Jamie Marich. I thank you for joining us today. Wishing you all the best with wellness.